Please. I want quality health care, but I don't know the answers to it. I don't know what it's going to cost. I don't know what it's going to look like. I don't know what we're going to have for benefits. I don't know whether ERISA is going to be exempt for a while and then come under the same plan. I don't know. The president told me I could keep my own plan. And now I'm being told by the state that that isn't going to happen. I'm not quite sure how in the state that we're living in now that we can create a system without knowing what the costs are and expect rational people like all of us in this room to be willing to accept it and get no answers.
This is largely, I think, a discussion about money. Basically, there are physicians that take care of patients in Vermont. Anybody in the state of Vermont, anybody in the United States can walk into an emergency room and get care. You can't be refused. So this isn't really a debate so much about access, but how to pay for access or how to pay for expenses once they're incurred. As far as the idea of paying physicians for the quality of care that they provide, that's a really hard one, because how do you measure that quality of care? The only way that I can see that the government or any other entity can judge that quality of care is by going down the checklist, and that's where the benefit of the electronic medical record is it gives the government the ability to go into everybody's medical record and go down the checklist. Did the doctor ask these questions? Oh yes, they asked those questions. The patient is depressed, or the child has ADHD, or whatever. Did the doctor prescribe the appropriate medication? Well, what if you, as a patient, don't want to be on that medicine? What if your belief system is such that you don't think that that's the right thing for you? I am now in a coercive relationship. Rather than being your advocate, I'm put in a coercive relationship that my reimbursement, how much I earn, is based upon me meeting somebody else's needs, what they think is right for you, not meeting your needs. I think that that's an abomination. It just, you can hear my voice, it pisses me off. But I've come to really a very important question, I think, which is to ask yourself, do you own yourself? Do you have the rights to your spirit, to your health, to your soul, to your being, to the productivity of your mind and your person, or does the community own that? Because if you believe that you own that, then you are being consistent with the founding of this state, the founding of this country, and the foundings of freedom. And the basic economic, social structure of that is capitalism. If, on the other hand, you believe, and it's free market capitalism, not this mixed gooey thing that we've had for the past 40 years in healthcare, and since FDR in everything else in this country, but real free market capitalism, not where the government's controlling half of it and maybe free market regulated whatever's on the other side, but actually let people compete, benefit if they do a good job, suffer if they don't do a good job. Let people in life suffer if they make bad decisions. Oh, that's pretty unique, but that's my harsh truth on that. If, on the other hand, you believe that the community owns you, that the community is responsible for you, great, but you're going down the path of Hitler, Mao, Pol Pot, Castro, every other communist, socialist, statist, fascist that there is. And we are talking about a fascist medical system here. Fascism is defined as private ownership with public control, to differ from communism. We're talking about having private ownership of medical practices, private ownerships of the hospitals, but the government controlling all that. And I feel that that's a very, very dangerous precedent for us to set for.
I've been thinking about healthcare, and I was just imagining the other day a scenario in which I walk into a car dealership and I think I want to go look at new cars. And the dealer says to me, you got to buy a car. Can't leave until you do. And I've got a car to sell you. I've only got one. I got one model. And that's the only car that I've got to sell. And you have to buy it. So, okay. And I take a look at it. The answer is no. You can't. Hasn't been designed even. But my brother-in-law and 5 of his friends are going to design it. That's going to be a better car. It's going to be cheaper. It's going to be easier to operate. Well, how much is it going to cost? I won't tell you. But what color is it going to be? What's its upholstery going to be? What are its options going to be? How fast will it go? I'm not going to tell you that either. Well, if the car's going to be cheaper to operate, how will it be cheaper to operate? Well, we're going to set a global budget for the gas. And you're only going to be able to use super economy fuel, and the fuel dealers are going to have to sell it to you at a super low price. Well, what if they won't? What if they go out of business? What if they decide to open their service stations in New Hampshire? Well, you can drive less. You can find different routes to work. And so on and so on and so on and so on. And when you apply that kind of logic to healthcare, by the way, politicians do rate lower in trust than car dealers. I'm not sure if there's a reason why, but it's just one of the things I've noticed.
Single-payer government regulates who is eligible to receive health care, who must provide it, what they must provide, how much they will be paid for it, and who must pay, and how much they must pay, and in what form. This is a very large administrative challenge, leaving aside any ideological issues. I once was in a panel with former Senator Cheryl Rivers, who was an ardent proponent of single-payer health care, and one of the persons in the audience said, well, how do you contain costs if everybody can have all the free health care they want? It's just not a problem. There's a global budget. Once that money is spent, that's the end of it. You contain costs exactly. My jaw dropped, really. This is an article of faith that when all the money is gone, all the responsibilities have been fulfilled. If you're lying out in the ambulance with a broken back, there's always next year. I will predict to you tonight that if we do move forward and implement this, it will be a catastrophic negative on Vermont's economy, and on Vermont's patients who seek medical care, and on the state's finances and taxpayers' pockets. Don't go down that road.